I really appreciate the invitation to come here and meet you all, because I don't come from the tinnitus world. As you've heard, I come from the neurodegeneration dementia world, but there are certain important overlaps. So it's fantastic to meet you all. And Anusha did ask me to give enthusiastic, lively talk, but now I'm so chilled, I'm almost asleep from her lovely introduction. So I'll do my best to keep things lively. So like tinnitus, the world that I work in neurodegeneration, these are conditions that don't go away. They're enduring conditions that people have to learn to live with and adapt to. And so our research is a little bit different from conditions which can get cured, conditions which disappear. And that's one of the challenges we have, in that trying to develop research, we really need to think about the long term. And to do that well, we really need to be informed by people who live with the condition. So people with lived experience. And that's the crux of what we're doing here today and the initiative that Anusha is leading and developing. But there is actually a formal way to do that, a formal way to involve people with lived experience in the research process, in the research endeavor, so that researchers and investigators can do their job better. And that endeavor is exactly what we're doing here. It's called PPI or PPV. PPI stands for Patient and Public Involvement. PPV stands for Patient and Public Voice. And that's essentially ensuring that the voices of people who are living with the condition, experiencing on a day-to-day basis, particularly in the longer term, are informing the research about that condition. So what I'm going to do now is just share some slides and give you some examples and a bit of explanation about the more formal aspects of this endeavor that we call PPI and PPV. Bear with me, just let me get my slides moving here. There we go. Okay, so for the next 5 minutes or so, I'm going to talk about getting involved with research. So here you see it, PPV or PPI, Patient and Public Involvement, or Patient and Public Voice, translating the lived experience to research. So what exactly is it? And I think this is the core definition that those of you who already work in this field will be very familiar with, and we keep coming back to this. This isn't research that's been carried out with or by members of the public. Rather, sorry, this is research that is being carried out with or by members of the public, rather than to them, about them, or for them. And I think that really encompasses this word of involvement, patient and public involvement, that people are deeply involved in the whole research process. And I'll explain a little bit more about that as we go. In other words, this idea of being actively involved. Now, as Anusha mentioned, one of the things I do is I lead Dementia Trials Ireland. Now, Dementia Trials Ireland, or DTI, is a research network in which across the country, a consortium of people are working together to try to increase the capacity and the capability to undertake dementia trials in Ireland. And there's a lot of work that has to go into that. But in order to do our work correctly and properly, we have to take on this process of PPI or PPV. In other words, involving people with lived experience to inform how we are going to run this network of Dementia Trials Ireland. And here's an example of some of the people that are involved, and you can see Anusha there. Now, Anusha isn't somebody that lives with dementia, but she is a member of the public in this regard, even though she's also a neuroscience researcher, who is helping us, along with other members here, who have different aspects or different involvement with dementia, to inform the research agenda. So within this group of people, some of these people will be living with dementia, others will be at risk of dementia, others will be care partners for people with dementia, others are advocates, and so on. And people like Anusha are neuroscientists who are supporting the process. And all of these are part of this PPI, or patient and public involvement process and panel informing our work. Now, engagement and involvement, this is kind of an entire spectrum that people can engage with. And at the very outside, this is what's called the Wellcome Trust onion model of PPI. And the very outside is kind of the lightest touch involvement that people can have. In other words, informing people about research, doing newspaper coverage, TV programs, spreading the word about what research is. And that's informing the public. And that's really important, but it kind of only goes so far. If you go from the outer part of the onion right into the middle, just going to move the pictures here, yeah, you can see that you're moving in terms of the impact that you can have as a member of the public. So you move from a kind of light touch information sharing all the way through to getting involved in the public debate, to shaping the research agenda, to thinking about attitudes, and then finally, eventually, to really making decisions about which research should be done and how it should be done. So this is the most impactful piece here. So when members of the public or people with lived experience first get involved with research, and I don't mean as participants, I mean as research informants, they often do start here, helping informing the public, sharing knowledge. But then gradually, as they get more and more involved, they become more and more impactful in terms of what they can offer and really shape the research agenda. So this kind of onion model is really important to keep in mind. Now, why do we bother? In many ways, involving PPI or PPV in research can be difficult. It is time-consuming. It can be frustrating. And sometimes it's easier just for researchers to get on and do the work and not worry about the public or people with lived experience think. But the question is that the right way to do it? So I'm going to give you some reasons as to why this endeavor is really important. And in developing a tinnitus program, a tinnitus research program, to try to do it as correctly as possible from the beginning, from the outset, and involving PPI. So these are some key principles that drive this work. So I'll just talk you through briefly each of them. The first one is what's called the emancipatory imperative. In other words, it's a drive to address the power imbalance between people who are taking part in research as research participants, the old word being research subjects, and the researchers themselves. So traditionally, there's been a group of people, the researchers, who hold knowledge, and then they kind of use the subjects or the participants in order to further that knowledge through the research process. But if those research participants, or subjects to use the old word, are more empowered, and there are people similar to them helping to inform the researchers do the work better, you're starting to address that power imbalance. And rather than having a them and us situation, you've got a collective situation, everybody's working together in the same direction. And that's about co-creation. Now, with that point, I'm going to jump to the bottom of the slide, this political imperative. Because the political imperative says that we are far beyond the point at which a certain group in society holds knowledge, like researchers, for example, or professors or doctors. Knowledge is shared and knowledge needs to be co-created. So that's that shift towards the democratization of knowledge. So by addressing the power imbalance, you start then sharing and co-creating knowledge. And that's an absolutely critical aspect of why we do PPI and why it's important. Now I'll take you to the middle piece of the slide there, the efficiency imperative. So efficiency is essentially doing things better for less money and wasting less. Now, for those of you who've been involved with research, either as participants or researchers, you know that research is a messy, complex, time-consuming thing. And very often it doesn't, most of the time, it doesn't follow straight lines. And we're always troubleshooting and trying to make things work. And as a result, there's often a lot of what we call research waste. And there are many ways to address research waste. And one of them is by trying to do things the right way and also address questions that are important, questions that matter to people with lived experience. And that's the efficiency imperative. And so by involving people with lived experience and members of the public in the research process, we can try to cut to the chase and make the research more meaningful, quicker, and do it better, rather than going down blind alleys or rather than doing things in a way that aren't going to work. So the emancipatory imperative about addressing power imbalance, the efficiency imperative about reducing research waste and doing things better, and the political imperative about knowledge co-creation and knowledge sharing are all the key principles behind PPI. And I think those are extremely compelling reasons why we should all engage in this process, even though it can be complicated, itself time-consuming, and sometimes difficult. Having said that, it's also a tremendous amount of fun. And I hope I'm going to finish my talk with convincing you of that. Now, one of the things that people often say is that, look, they're not researchers. They don't know the details of the science, which you're going to hear about a little bit later from Sven. And therefore, how can they meaningfully contribute to research? Well, they can do so in many ways. Now, this is an example of what we call the research cycle. And there's various steps along the way, and I won't go through the whole thing. But essentially, it starts off with asking questions, then writing grants and getting the funding to run the research, then designing the research project and managing it, and then undertaking a project, and that can involve recruiting participants, providing an intervention or whatever the research may be, coming up with the findings, interpreting those findings, and then disseminating them, making sure the word is spread, because there's absolutely no point in doing research if the findings are hidden away on a shelf or in a thesis or in a publication that nobody reads. Dissemination is absolutely critical. Now, that is the research cycle. You can imagine, in thinking through each of those steps, the huge contributions that members of the public, PPI members, or people with lived experience can make in this cycle. Starting off at the top by identifying and prioritizing the research questions. We cannot answer every single unknown question. We cannot address every gap in the research. But by asking people with lived experience what's important to them, we can start to prioritize and say, this is most important, let's do this first. This is second on the list, let's do that next. So contributing to actually understanding what the research agenda is critical. The next thing is about getting that funded. So members of the public can sit on the funding agencies' panels to try to understand which projects should be funded and which ones shouldn't be funded. And extremely important for people from the public to look at projects and say, this isn't appropriate for people with lived experience and therefore it shouldn't be funded. So nowadays, most research funding boards and bodies will have members of the public and people with lived experience on their boards, providing the impact, or providing the input rather, to the funding agencies to try to identify the best research to go forward. The next piece is about designing and managing the project. Researchers know their topic, they know the science, they know lots of things about the subject, but they may not know how best to run a study for people with a particular condition. They may be asking too many questions. They may be demanding too much time from people. They may not be recruiting people in the right way. They may not be sharing information about the study in the right way, using the right kind of language that's accessible. So all of those elements and many more of how the research is conducted can be improved and modified by the input of PPI members. The next bit is disseminating the research. You have to share your findings in order for it to have impact. And again, researchers and investigators and scientists are extremely good at sharing their work amongst themselves and talking to each other. And if you go to a big conference, there might be 20,000 researchers all talking to each other. And that's great. Then it can move the field forward. But that doesn't move the field forward for people with lived experience, because that information has to be translated and has to get out of the conference hall. It has to get out of the medical journals and into the public space so that people can understand what's happening and apply it in the most appropriate way. And that's, again, the patient and public involvement is absolutely critical to help translate the scientific findings, the research findings, into the public space so that it can be shared. So the point of this slide is to demonstrate that every single point in the research cycle, members of the public, people with lived experience, can contribute in extremely important and significant ways. So I'm going to end up with the last few slides. Oops, the quality's gone here. Apologies for that. By sharing one of the most remarkable PPI, patient and public involvement events that I've had the privilege to be involved with. And this was something that took place last year. And it's an example of PPI at its best and having great fun. So one of our fellows in global brain health, his name is Fernando. He's actually a journalist. And he devised this event, an immersive interactive event called WTD, or Walking the Talk for Dementia. And it was an opportunity to get a whole host of people, 70 in fact, from around the world, walking together along the Camino in Santiago de Compostela for 4 days, talking, interacting, sharing ideas, sharing knowledge, co-creating knowledge, thinking about how they should move the field forward together. So this is the Irish contingent here. So just in this one picture, you have Kevin, who's a person with lived experience. So he has a neurodegenerative condition. This is his wife. So she has experience of the lived condition as a care partner. This is me over here. So I'm a clinical academic and researcher. This is Eleni. She is also a researcher, but she comes from the artistic side, and her specialty is in dance. And her work is looking at how dance can be important in trying to understand and support people with dementia. And this person here at the end is a nurse. So she's a nurse researcher. So again, you're seeing here for 4 days, you have people from different aspects of this world of dementia, and in your case, it would be tinnitus, working together, sharing ideas, sharing perspectives. And I'm going to show you some other pictures from here. So again, here we have a health economist. This is Stefania. And here we have a neurologist from Spain. These are part of our GBHI members. And here we have, again, a researcher from Zimbabwe. And they are all working together with people with lived experience to try to understand some of the best ways that we can move the field forward. And here we have somebody from Brazil. And she's an advocate, and she runs one of the Alzheimer federations in Brazil. And she has brought all these ribbons along on the trip. Each of these has a name of one of the members of the federation, and she's walking for them. So she's representing their views and their voices as everybody walks together, sharing ideas. This couple comes from the United States. So this lady here is living with dementia, and this is her daughter. And they went on the walk sharing their perspective as Americans coming to Europe, living with dementia and being care partners for dementia. This couple here, again, with lived experience. This is Des and Vali. They're from England. Again, Vali is a care partner and wife of Des. Des lives with an enduring condition. At the back here is Fernando, who organized this. So there we were for 4 days, sharing ideas and working together in knowledge co-creation and co-sharing. And this here is Wendy. Wendy is one of the key people in Alzheimer's Disease International, which is a very important international advocacy organization. And Wendy walked with us and shared her ideas as how advocacy can support this endeavor. And that's where I'm going to end. So Walk the Talk for Dementia is one of the most remarkable, fun and exciting examples of PPI at its best. And I'm going to leave it there, and hopefully that gives you a little bit of food for thought about some of the things that you might be interested in doing for tinnitus.